We are talking about the latest on the coronavirus, the Delta variant, and setting the record straight on some vaccine misinformation. KPIX5's Christine Samra sat down with a Stanford healthcare doctor.
A new study shows that the Johnson & Johnson COVID vaccine may be less effective against the Delta variant. So if you've already gotten the Johnson & Johnson vaccine, should you get a dose of the Pfizer and Moderna one to protect yourself just in case?
That's a great question. We are hearing a lot of that. The study in question was actually just to be fair, it is preprint, meaning that it hasn't been reviewed by any journals yet. This was posted by the authors, and so it hasn't really gone through any sort of peer review yet. That said, it was a study that looked at the amount of antibodies or neutralizing antibodies, which are hopefully the types of antibodies that would be protective, the amount of neutralizing antibodies made by people who had the infection compared to those who had had the Johnson & Johnson vaccine compared to those who had had an mRNA vaccine. And what they found was that the amount of antibodies was higher in the group of patients who had gotten mRNA vaccines compared to those who had had the infection and those who had the Johnson & Johnson vaccine. However, there are a few really important precautions on interpreting this. We don't know whether antibodies by themselves are tell us whether somebody is protected against COVID or not. And so it's, we don't know yet whether having low levels of antibodies means that you're not protected. We don't know that higher levels of antibodies from the mRNA vaccine are more protective than the somewhat lower levels that we're seeing with the Johnson & Johnson vaccine. This study did not look at any clinical outcomes. So it didn't actually look at whether people were getting infected or not after these vaccinations and whether there was a difference. So, and it also didn't look at other branches of the immune system, including T cells, to see whether there was a response. So it's really important to know that this study I would not take to mean that Johnson & Johnson is less protective. There was actually a study that just came out a few days before that was peer reviewed in the New England Journal of Medicine, which is one of our industry standards for journals. And this was a study that looked at Johnson & Johnson vaccine recipients and how much antibody and also how much T cell response they produced initially and then 8 months later. And it showed that actually both the T cell response and the antibody response are incredibly durable over that period of time. And so that's actually really good news. That's really reassuring that that antibody level didn't fall off. And in fact, it went up. So, that is good news, I think, for Johnson & Johnson recipients, that both the T cell response and the antibody response were pretty durable. So neither of these, though, looked at how much people were getting infected after each type of vaccine, though. So to extrapolate, not to extrapolate, but to look at that kind of data, you would have to do a lot of sequencing of strains that are popping up in the community. The US is not doing as much of that as, say, the UK. And in the UK, there was a study that came out of the UK looking at the AstraZeneca vaccine versus mRNA vaccines. And the AstraZeneca vaccine is an adenovirus vector vaccine, as is the Johnson & Johnson, but it is a different vaccine. So we don't know how much we can really compare them to each other. But there was a somewhat reduced effectiveness of the AstraZeneca vaccine compared to the mRNA vaccines against the Delta variant. I think it was like 88% versus 67% effectiveness. But again, we don't know whether that means anything for the Johnson & Johnson vaccine. We don't have that direct evidence yet.
So for those people who are fully vaccinated, we know that if you do get COVID-19 and you're fully vaccinated, reports say that you may feel your symptoms will be less severe. So how do you know if you're fully vaccinated, but you start feeling sick? How do you know if you have a cold or if you're having low symptoms of COVID-19?
You really can't tell. Even, so common colds, a lot of the respiratory viruses that are circulating in the community can cause a common cold. Some cause croup. and one in particular causes croup. And then there's seasonal allergies, and all of those can look really similar. They can all cause fever, congestion, runny nose, cough. So, if you have symptoms, the best thing to do is just go get tested. There are so many reasons to get tested. There's so many ways to get tested now, whether you do a home kit or you go to your local pharmacy or you go to a local clinic or a lab to get tested. There's so many ways to get tested. It should be quite fast to get the results back. And then you can just kind of put that at rest, to put that question to rest. Having that information makes a big difference for how you're going to, be with your family and how you're going to handle things with work and whether you take precautions against spreading it to other people in the community. Doing more testing is going to be really key to helping to control how much this virus is spreading in our community when there are so many people who are still not yet vaccinated.
So there's a lot of misinformation out there on the vaccine. The Surgeon General called it a serious threat to public health, all the misinformation out there. Many people claim that the vaccine interrupts fertility for women that are looking to have children sometime soon. Can you set the record straight on any of these wild theories out there or a lot of the misinformation?
It's really tough. These are such examples of how rumors and false information that it can be really scary spreads so much faster, like wildfire, compared to the truth. The nuanced truth is like, running through molasses. It just travels so slowly sometimes. It just doesn't spread as in an as exciting a way, But there is no truth. There's no factual basis to the claim that COVID vaccines affect fertility, period. There is no evidence that it has any impact on the fetus for women who are pregnant and breastfeeding. And in fact, it is very much advised that pregnant women get the vaccine because of the higher risks that we're seeing posed to women who are pregnant. So it is really important to look for the facts, look at the evidence behind what people are forwarding you or posting on social media before believing it, because taking the attitude that, well, I'm just going to wait and see a little bit longer until there's more information, there's a cost to that waiting. I personally have seen it among a few of my patients to their detriment, unfortunately, that they've been surrounded by social media and also their own communities, people within their community spreading misinformation. And really sadly, then not wanting to get the vaccine and winding up hospitalized and in a couple of cases dying. So there's a real human cost to this misinformation. And it's really heartbreaking when it winds up that way. So please, do some careful research before believing what you see on social media or what you hear from people.
All right, Dr. Liu, thank you so much for joining me today and putting those rumors to rest. I appreciate it.
So great to see you, Christine. Best of luck with everything.
Thank you. You too.